Welcome to the Homegrown Heart Podcast every Friday at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, smoking, cigarettes, marijuana, and vaping. Help me welcome our host, Dr. Amanda Ryan.
Good morning, Carlsbad, Eddy County, and surrounding and faraway listeners. This is Dr. Amanda Ryan, your friendly interventional cardiologist, here in Danny Fletcher's studio. And this morning we're going to continue our Heart Healthy podcast lessons with a show about smoking, vaping, the dangers, the cardiovascular risks, and what we know so far. Smoking is a major cause of cardiovascular death and is responsible for 1 in every 4 deaths that occur from cardiovascular disease in the United States, which again remains the #1 killer of all United States citizens. Secondhand smoke exposure also causes increased risk of heart disease and stroke. Quitting smoking can protect people from cardiovascular disease and death. People who already have heart disease also can benefit from quitting smoking. I get that a lot. I love primary prevention, and again, throughout this podcast, if you're following along, we'll talk a lot about primary and secondary prevention. Secondary prevention is unfortunately what we're faced to deal with a lot. And what does that mean? You already had a stroke. You had an acute heart attack. You had multiple stents put in. You have blockages in your legs. And you smoke, and we're trying to work with what are your modifiable risk factors. And the #1 modifiable risk factor that we all have is smoking. Okay, if you smoke, that is your #1 modifiable risk factor. You know, again, we talk a lot about genetics and play a role, and there's some people I was like, oh, well, my dad had this, etc. But my dad smoked also 2 packs per day. So sometimes separating what is truly probably a genetic predisposition to a disease and the realities of your own lifestyle habits and how they're playing a role. Diabetes is really a modifiable risk factor. You can't change that you have a propensity for diabetes, but much type 2 diabetes in particular is a disease of obesity and diet choices. You can often diet control your type 2 diabetes with appropriate exercise and dietary choices. Smoking is similar. And yes, the less you smoke, the better. However, complete zero is obviously the goal. Again, peripheral arterial disease, which PAD awareness was in September. We're doing more and more at Advanced Ambulatory Surgery Center of Carlsbad, New Mexico, really working on people's legs. We have a relationship with Dr. Raja in El Paso, Dr. Paoni in Lubbock, Dr. Prophet up in Albuquerque. All of these doctors are doctors that will help us clean out leg blockages, do open bypasses on people's leg arteries when it gets to that point, depending on the situation. Dr. Raja, again, who I've spoken about in the past, is actually a critical limb ischemia specialist. He is actually doing things that often create a fistula between an artery and a vein in your leg, often your foot, basically creating a connection between the diseased artery and the somewhat healthy vein, just to get enough blood flow to heal your wound so that you don't end up with an amputation. He has an organization as part of called CLIF. It's a Critical Limb Ischemia Foundation in El Paso. I am a speaker at their yearly conference this Saturday over in El Paso, where I'm going to talk about our RULE program and what we're doing out here as CLI fighters, as well as I get to be a panelist when Dr. Raja does a case that will actually be live worldwide. He has trained people all over the world and been at conferences and is truly a critical limb ischemia expert. That means you're about to lose your foot, and we're trying everything that we possibly can, knowing that that's going to lead, again, eventually at first it's half your foot, maybe a couple toes, half your foot, then at your ankle, then below your knee, then above your knee. And then often it goes to the other leg, similar situation. Poorly controlled diabetes and significant PAD are the two big factors that lead to that. The two highest risk factors for peripheral arterial disease, meaning blockages in your leg, are diabetes that is poorly controlled and smoking. On the opposite side of that, I'm going to give a shout out to a few of my long-term patients. I have a few type 1 diabetics. That's a totally different disease process than type 2 diabetes. Type 1, again, you're not producing insulin. It has a different genetic situation. And many people are diagnosed with type 1 diabetes anywhere from 2 years old up to potentially mid-teens. I have some people that are 70 years old that have had type 1 diabetes since they were 2 to 4 years old, and they have very minimal side effects from that disease at this point. They do have some, but they have controlled their sugars so tightly. And there have been some things that have really revolutionized diabetic care in the last several years. So while, again, today we're talking about smoking, I always take an opportunity to pull things together as relevant. And diabetes and smoking are really like lighting a match to coronary disease, strokes, peripheral vascular disease. I mean, they're close friends. So if you have both, it's really a true additive effect. So people ask me, what does smoking really do to my heart? Okay. It raises your triglyceride levels. It actually lowers your quote unquote good cholesterol, the HDL. It makes your blood sticky and more likely to clot, which can block blood flow both to your brain, your heart, your legs. It can damage cells that line the blood vessels. It does increase the buildup of plaque in your blood vessels, and it causes thickening, narrowing, and decreased elasticity of your blood vessels. All of those things increase your risk of atherosclerosis, of coronary heart disease, including heart attacks and sudden coronary death, strokes, peripheral arterial disease, and abdominal aortic aneurysms. I've talked, again, September is also Abdominal Aortic Awareness Month. Not just abdominal, but whole aortic awareness. And I talked to you guys about how I had patients that had genetic predispositions to stretchy aortas, and they were prone to dissections and aneurysms, and how I work with Dr. Barron and her group out of Houston, and what we're really doing to get the awareness out there about aortic diseases. But many aortic diseases, particularly abdominal aortic aneurysms, and you might have commonly heard that referred to as a AAA, they occur almost exclusively in people that have either genetic predispositions like Marfan's and Loeys-Dietz connective tissue diseases, or they occur in smokers. To the point where Medicare will pay for a screening abdominal aortic ultrasound for any patient that has smoked that is older than 65. That's how important it is. And what is an aneurysm? Again, is an outpouching of your aorta right here in the middle of your stomach. It can occur above or below your kidney arteries, and that has some relevance about the options to fix it. But there's a certain size that is usually around 5.0 centimeters that if your aneurysm, meaning the walls of your artery, outpouch to that degree, that your risk of sudden death from that rupturing is quite high. We used to have to do major open abdominal surgery to get to that and fix it. I've talked to you about my grandfather and how he passed away and what the options were back then. And that now we're often able to fix these up through the groin, through the femoral artery, which has a lot lower perioperative risks associated. So we've came a long way in many ways. Estimates show that smoking increases your risk for coronary heart disease about 4 times, and for strokes about 3 to 4 times compared to not smoking. Even people who smoke fewer than 5 cigarettes a day often have signs of early cardiovascular disease. Secondhand smoke. I will say again, I'm not a controlling person in the sense of feeling we should regulate and control everything, but definitely my mama and my cardiology heart get heavy when I see children in a car that's full of smoke. In this day and age, we know better and we really have to do better. If you choose to smoke in your own environment and affect yourself, that is definitely your choice. But choosing to expose others to it as well as your children is really a selfish decision. Secondhand smoke is basically the smoke from burning tobacco products, cigarettes, cigars, pipes, hookahs. Secondhand smoke exposure occurs when people breathe in the smoke from these burning tobacco products. And exposure to secondhand smoke increases the risk for both coronary heart disease and stroke. Each year in the United States, secondhand smoke causes about 35,000 deaths from coronary heart disease in people that do not smoke, and about 8,000 deaths from strokes in people who do not smoke, who have problems linked to secondhand smoke exposure. People who do not smoke but breathe in secondhand smoke are increasing their risk of developing heart disease by about 25 to 30%. Breathing secondhand smoke, even for a short time, can cause damage to blood vessels and cause the blood to become stickier, and these changes again will increase our risk of having a heart attack. Now vaping has kind of taken over, especially with our younger population. We have made some progress on the don't smoke cigarettes and don't ever start. I think even a lot of older experienced smokers have given a lot of wisdom to the younger generation that it is a very hard habit to stop, and that although there are a lot of resources out there for quitting, and I've talked about those before too, there's a New Mexico Quit line, which again, and there's a lot of resources available in both English and Spanish, and I'll share those with Danny and make sure that we show them on our podcast. We also give them out at our office, and Michelle Rain, one of our nurse practitioners with the practice, has really focused lately on smoking cessation. She helps run our chronic care management program. And as part of that, heart failure is one of our big factors, and smoking increases our risk of heart failure. And she's very interested in trying to decrease the rates of smokers within our population and our practice. And so as part of that, we have a lot of that information at our office. If you have any interest in discussing, we will usually bring up to you if you are a current smoker. But if you have interest in that, please make sure that you talk to our medical assistants, myself or Michelle, about that. So switching to vaping, it has no tobacco products, no tobacco products, including e-cigarettes, are safe. There is no evidence. Most e-cigarettes contain nicotine, which is highly addictive, has a health danger, particularly for pregnant people, developing fetuses, and youth. We do not know the real risk of vaping when you've done it since you're 13, 14, 15, 16 years old. We're going to take a generation or two to figure that out, unfortunately. Aerosol from e-cigarettes can also contain harmful and potentially harmful substances, cancer-causing agent, chemicals, tiny particles that can be inhaled deep into the lungs. E-cigarettes should not be used by youth, young adults, or people who are pregnant. They have the potentially they may benefit adults that smoke, trying to get them off of cigarettes as a little bit of a transition. But scientists still have a lot to learn about the short and long-term health effects of using e-cigarettes, and I have yet to meet a pulmonologist or a cardiologist or a researcher who is supporting their continued use, for sure. Most e-cigarettes or vapes contain nicotine, and nicotine is highly addictive. It's toxic in many ways. Acute nicotine exposure itself can be toxic. It can harm brain development. This is a lot about developing fetuses in young children. It can, again, harm parts of the brain that control attention, learning, mood, and impulse control. So again, nicotine is a highly addictive substance. There's cancer-causing chemicals in many of these vapes. There are heavy metals such as nickel, tin, and lead. The tiny particles can be inhaled deep into the lungs. There are volatile organic compounds and flavorings such as diacetyl that's added as a chemical linked to serious lung disease. So the reality is this stuff is not regulated on a level that we totally understand what all the risks can be, but definitely there's nobody in medicine or science that thinks long-term vaping is a reasonable alternative to cigarette smoking. If you are addicted to nicotine and you're trying to quit, it definitely can have feelings of being irritable, jumpy, restless, anxious, sad, or depressed, having a hard time concentrating, feeling hungry, craving nicotine. These are all withdrawal symptoms, and they can certainly last for about 3 to 5 days typically. Interesting, the acute withdrawal and the physical addiction lasts a short time. I think the mental and emotional addiction to smoking or vaping, it's the hand-mouth, or I smoke when I do A, when I do B, that can really last a lifetime. There are a lot of behavioral resources out there. There are a lot of different options. There are medications that I always tell people, they can potentially take the edge off, etc., but you've got to be ready to quit. With the holidays comes a lot of different discussions, a lot of different resolutions, a lot of what we're going to do in 2025. I implore you, if you smoke or vape, look at 2025 as a new adventure. Make a quit date and work towards it. Studies have shown the average person tries to stop smoking about 7 times before they completely accomplish it. As your public service announcement this morning, I'm asking you to do everything within your power for yourself and your family and society as a whole to stop smoking. Thank you. We'll see you next week. Have a great holiday season.